Hello, my name is Chris Shea, and welcome to this presentation on long-term care insurance. I am a financial advisor with BPS Financial Services. I'm a financial planning and implementation partner with my clients. I help them to decide what they want and then implement their choices. With that, I'd like to go over the agenda. I've done my introduction, ground rules, listen, learn. If you got questions, feel free to reach out to me and ask questions. But ultimately, what do you know already or want to learn about long-term care? You hear about it a lot. It can be very confusing. I get it. But we're going to talk about it. So the agenda, who needs it? Common myths. Where are services provided? Cost of care. How will you pay for it? Why is this important? And the benefits of it. So let's go through it. Who needs long-term care? I don't know. Most people probably need a little bit of long-term care because no one really knows what the future holds in store. As people age, they might need help with things that they weren't able to do themselves. Accidents and injuries for younger people, they might need long-term care assistance too. You don't know, but it's something you should plan for and think about. Myths. What are some common myths? Health insurance covers long-term care. Nope. Will not cover it. Health insurance is for health problems that are urgent, not for ongoing things. Medicare is going to cover all my long-term costs. Nope. Medicare is there again for urgent things that come up, not for day-to-day things that might be there persistently. Medicare is the same thing as Medicaid. Nope, they're different, and you've got to talk to a professional who specializes in Medicare and Medicaid to be able to figure out what you're going to be able to want to cover for yourself. And then the other one is I'm too young to buy. Absolutely not. If you can afford it and want to plan, the earlier you start, the less it's going to cost you on an ongoing basis, and the less it's going to cost you in general. So plan for it if you've got the means to do so. One of the things that always comes up is where services are provided. Long-term care does not mean you've got to go to a facility. It can be in your home, community. It could be an assisted living facility, or it could be in a nursing home. When my father was hurt towards the end of his life, we brought in people to service him in the house. My mother couldn't do it. I couldn't be there all the time. We brought in professionals to give him help inside of our home. It was a nice little benefit. I was able to stay in the house he and my mom had owned for 30 years and enjoy being there as opposed to being in a nursing home or an assisted living facility. Other people want the assisted living facility because it's just easier. It all depends upon what you want, but there's a multitude of places in which your services can be provided. Cost of care. Yeah, this is where people start to get a little concerned. And this is as of 2018, 2019. Home health aid is about $25 an hour, $56,000 a year. Assisted living, average $6,000 a month almost, or $71,000 a year. Nursing home, semi-private care, not even the private care, about $254 a day or $108,000 per year. And a nursing home private, $290 a day, $123,000 a year. Those are just averages. If you live in an expensive city, New York, Chicago, San Francisco, Boston, Washington, D.C., it's going to be more expensive. If you live in more rural areas, it's going to be less expensive. But these are the averages. It costs a lot to take care of the elderly and people that are ill and sick and need long-term care. So plan for it. Again, this is not designed to scare you too much, but to just give you some education so you can make some informed choices. How are you going to pay for it? You might not have the money in the bank when you need it. You might have to sell assets, a home. You might have to sell a car. You might have to sell a boat, jewelry to pay for it. There could be taxes from income, loss of earnings because you have to work less at a job because you got to spend time with someone. You could rely upon Medicaid, program of last resort for people with limited assets. The service isn't the best when you have Medicaid, right? You have to spend down assets to qualify. You may have to sell a house before you can qualify for Medicaid. And the states may seek reimbursement from your estate for benefits paid to you. What does that mean? You owe $100,000 in Medicaid. When you pass, your house costs $400,000. State takes $100,000 off the top. That's the way Medicaid works. Plan for it. So how are you going to pay? You could purchase long-term care, could supplement your out-of-pocket expenses with benefits out of your policy, could protect some of your assets, and it may allow you to stay connected to the things that matter most to you, right? Your family. Enable you to stay with them instead of having to go to a facility. Why is it important? It may be an important component of your overall plan. It can pay a portion of your expenses. It can protect against your retirement assets being whittled down. And it may allow you to spend retirement the way that you planned, as opposed to having to be stuck just worrying about how you're going to pay for your long-term care. It can suck all of your money out of you if you haven't properly prepared for it. Now let's get into some of the stay-at-home benefits, right? They can keep you there as long as possible. They can have a home health aide come in. Again, that's what we did with my father. It can help with household tasks, cleaning, meal prep, bring somebody in, right? It can help with bathing, personal tasks. I know that my mother couldn't help my father take a shower. Didn't want his kids to do it. Brought in a professional. Can get you equipment, walkers, wheelchairs. We had a ton of them for my father, all provided through some of the benefits. And they can easily even help with home improvements to make your home safer. Ramps, accessibility, changing the door, changing the shower. All those things can be provided with some of the benefits. You've got choices. You got a lot of options on how you're going to receive the benefits. It can either be cash, which has a lot of ways around it, and there's a lot of rules, so you're going to want to talk to a professional about it, or it can be a distribution. The benefits begin after an elimination period, aka a time of where you have to cover it yourself. And they can actually get dispersed right to the institution that bills them. You don't even have to see any of the money. It just goes and you don't have to worry about it. Again, the way that you want to work it is the way that you can set it up in the contract. So again, long-term care is a very important thing if you want to be able to plan for the way in which you're taken care of over long term towards the end of your life. I'm sure you've learned a little bit, but you've also got a lot of questions, so feel free to ask them. If you got an evaluation, please reach out to me as well. I'd love to hear some feedback. Always looking at ways to improve. So in conclusion, hopefully you've learned that long-term care is important and people need it. It's an important thing. Hopefully we've been able to talk about some of the myths versus the reality of long-term care, so you know that you're never too young to start preparing for it if it's something that's important to you. We've talked about some of the services, the costs, options for payments, why is it important, and then ultimately your choice of benefits. So again, my name is Chris Shea, financial advisor, and hopefully you've learned a little bit about long-term care insurance.